Hello, I am Kurt Gilmeister and I am a pharmacy student at the University of Illinois at Chicago's College of Pharmacy. In this short video, I will discuss type 2 diabetes and a useful tool offered by the American Diabetes Association for personally assessing your risk of the disease. Over 34 million individuals in the United States have diabetes, and 1 in 5 of those are not even aware that they have it. In the past 20 years, this number has only grown, with the amount of adults diagnosed with diabetes more than doubling. This is partly due to the fact that the American population has grown older, and that being considered clinically overweight or obese has become increasingly common. It is a common belief that by being diagnosed with type 2 diabetes, this will only be affecting your blood sugar levels and what foods you should be eating in the future. But in reality, there are many health complications that are disabling or even life-threatening that will result from being diagnosed with diabetes. It will have a very strong impact on your circulatory health, dramatically increasing your risk of various cardiovascular problems, including heart attack and stroke. Furthermore, these circulatory issues may eventually lead to damage throughout other organ systems such as your kidneys. This is due to our kidney being composed of millions of tiny blood vessels, which allow for a very delicate and advanced filtering system for waste that eventually accumulates in the blood. Diabetes may cause severe damage to this system, which can lead to irreversible kidney failure and end-stage kidney disease. Such complications will lead to requiring the use of dialysis and ultimately a kidney transplant. These cardiovascular effects are witnessed in organs critical for life, as well as sensory structures such as your eyes. Diabetes can damage blood vessels of the retina, which eventually may lead to blindness or other serious vision concerns, such as cataracts and glaucoma. Nerve damage in extremities as a result of low blood flow may also lead to serious infections, which combined with poor healing factor ultimately will require a toe, foot, or even entire amputation of a damaged limb. In addition, those diagnosed with diabetes are at an increased risk of skin conditions, hearing impairment, and neurological issues, with some studies being made suggesting diabetes may also contribute to the development of Alzheimer's disease. By knowing your risk of being diagnosed with diabetes, you may better combat these complications and prevent permanent damage resulting from the disease. Being diagnosed with type 2 diabetes means that your body improperly uses the hormone insulin. Where this can sometimes be controlled with lifestyle changes such as a healthy diet and exercise, further medication or insulin intervention may be required to manage it. As type 2 diabetes progresses, your body becomes more resistant to insulin, as it no longer can use the hormone efficiently. In turn, your pancreas begins to function more intensely to compensate for this condition and begins to produce more insulin. Over a duration of time, this can begin to damage the cells within your pancreas to the point that they no longer are able to produce any insulin at all. As scary as this condition can appear, it is important to note that because of its commonplace in our modern society, you will likely have the tools you need to keep your diabetes in check and live a productive and comfortable life. The American Diabetes Association, also referred to by the ADA, provides valuable information and assistance in the fight against diabetes. They fund research for the prevention, cure, and management of the chronic disease state diabetes. In addition, they deliver services to hundreds of communities to provide objective and credible information, as well as giving a voice to the great population of those denied their rights due to the disease state. With a mission to improve the lives of all those affected by diabetes, and seeking a life free of diabetes and its burdens, the American Diabetes Association represents an enormous fight against the condition and its prevalence in our communities. The American Diabetes Association began releasing risk assessment tests for public use in 1993. This test was founded by a published study and further assessed using data from the CDC, otherwise known as the Center for Disease Control and Prevention. While the test was being developed, researchers looked for specific characteristics that were proven to make a person more likely than average to have an undiagnosed type 2 diabetes condition. To make the tool as user-friendly and easily applied as possible, they specifically considered health characteristics which people would likely know on hand without needing a more specific diagnostic tool such as a blood test or another type of medical evaluation concerning blood glucose levels. The ADA risk assessment chart requires basic information such as a person's age, weight, height, and activity level, to name a few criteria. A score of 5 or higher on the risk assessment test means an individual has a marked increased risk of having undiagnosed prediabetes or type 2 diabetes condition. Only by visiting a medical provider and participating in a blood test can a complete diagnosis be determined. To take the risk assessment form, you can either find it on the web or go to your local clinic in which it may be provided for you. In that case, it will be easier to go through with a health professional. To have the most accurate depiction of your current risk level, it's important to answer each question to the best of your ability. Some questions may require you to reach out to family members to confirm if you do have a past history of diabetes in the family. Although you may be unaware of any history of diabetes in the family, it would be worth the time to reach out to a family member to confirm, as genetics do play a pretty heavy role in susceptibility of the disease. Once you finish the questionnaire, you can then begin to go through the form with a clinician if you are at a clinic at the time. Otherwise, tally up the points on your own and see at the bottom which category you apply to. Each question on the form attributes its own amount of points, the first question being your age, which can contribute 0 to 3 points, the second being if you are a man or a woman, men receiving 1 point. The third question is if you have gestational diabetes. The next question considers whether or not you have an immediate family member who has or has had diabetes. The fifth being if you have been diagnosed with high blood pressure. The sixth, whether or not you are physically active. And the seventh question pertaining to the weight and height chart, which itself can contribute between 0 and 3 points depending on where you are placed. If the addition of your points has you at a score of 5 or higher, you have an increased risk for diabetes, and it is recommended that you follow up with your primary care provider to discuss possible further diagnostics or lifestyle modifications. Approximately 84 million American adults have prediabetes. This is a condition where blood glucose levels are higher than normal, but not quite enough to be diagnosed with type 2 diabetes. In addition, around 90% of those with prediabetes are unaware that they have the condition. With such a large population of Americans at risk for developing type 2 diabetes, it is critical to spread awareness of the disease and for those to learn their personal risk of acquiring it. This as well as being screened regularly and taking necessary steps to delay or even prevent prediabetes or full diabetes from occurring. Diabetes is the 7th leading cause of death in the United States, and this amount is expected to be severely underreported. If you see that you have a high risk assessment score or feel that you have a greater likelihood to being diagnosed with type 2 diabetes due to personal lifestyle habits or because you have a family history, it is recommended that you schedule an appointment with your doctor to further discuss possible testing for the condition. Like all health concerns, diabetes is best managed by taking action as soon as possible. For further questions related to type 2 diabetes and similar conditions, you can visit ADA website at diabetes.org or call 1-800-DIABETES.